Healthcare reform is designed to make insurance more accessible, but a new report says it could do just the opposite. Good evening, everyone. I'm Steve Hensley. Leading our news tonight at 6, a U.S. Senate committee is expected to vote tomorrow on a comprehensive reform bill. But an insurance industry report claims some people would have to pay hundreds, if not thousands more for coverage. WYMT's Jeff Allen is in our Cumberland Valley newsroom with more in tonight's top story at 6.
The report says lawmakers' decision to not require all Americans to get coverage would allow people to postpone coverage until they are sick, and they say that's something that would raise the cost for anyone with private insurance.
Healthcare reform is designed to help those struggling to pay for medical bills. But if it passes, many people worry how they'll cover costs.
I think a lot of things will probably increase because of it. The insurance probably, the cost and the premiums.
America's Health Insurance Plans and Industry Trade Group is warning insurers and patients that by 2013, families could be paying about $1,700 more on their premiums per year. It also projects individuals could be paying about $600 more per year.
The cost of medicine, the cost of living is so high right now, we don't need, our insurance to go up. And a lot of people can't afford insurance where they're so high.
The report says new taxes on insurers and healthcare industries and cuts in Medicare payments to doctors and hospitals could drive costs even higher.
If we are continually cut, we're going to have to reduce services or go out of business, and then we won't be able to provide the service to our people.
And Pineville Community Hospital's CEO says smaller hospitals across eastern Kentucky could be in jeopardy if reform legislation passes.
We're very important not only in the health care but also to the economy. We need to be here. The people need us.
But he worries if health care reform passes, the hospital might not survive, pushing care not only higher in cost, but physically farther away from those who need it.
Now, a spokesman for the chairman of the Senate Finance Committee, which is set to vote on this legislation tomorrow, says the insurance industry report is flawed since it doesn't point out parts of the bill that actually lower the cost of coverage. In the Cumberland Valley newsroom, I'm Jeff Allen. Steve, now back to you.
Jeff, thank you. Healthcare is the topic of our newest web poll. We're asking if you support the Baucus plan pending before the Senate Finance Committee. You can vote now on our web channel, WYMTnews.com. We'll have the results Wednesday on Mountain News First at 4.